In this lesson, we're going to introduce you to the most commonly used insurance-related terminology that those working at the front desk, check-in, and check-out need to know. Although these positions generally don't require particularly advanced knowledge of the terms we discuss, you will need to at least be familiar with their basic concepts. It's also worth noting that we will be covering these terms in alphabetical order, which doesn't necessarily reflect their order of importance or frequency of use in the clinic. So let's begin with Advanced Beneficiary Notice, more commonly referred to as an ABN. An ABN is a written notice, essentially a waiver, that patients sign in order to confirm their understanding that a requested procedure or service may not be covered by their insurance. ABNs are important for a few reasons. First, patients are generally under the impression that procedures or services performed during any given visit will be covered by their insurance. So an ABN essentially serves as proof that the patient was told in advance that the procedure or service performed would likely not be covered by their insurance. The second reason ABNs are so important to have signed before performing any potentially non-covered procedure or service is because some contracts, as well as some state laws, prohibit patients from being charged for services if an ABN wasn't signed in advance. So not only do ABNs give patients a proper heads up about the potential charges they may incur, but having an ABN signed gives the practice the right to charge the patient for those services. Without the ABN being signed, the practice may not be allowed to do so. The ABN should include an estimate of the cost and an explanation of why the insurer, such as Medicare, may not pay. As you can imagine, ABNs are particularly important for when cosmetic procedures are performed. Tip: securing an ABN when one is needed is a team effort. Making the mistake of not collecting a signed ABN is more likely when patients schedule an appointment for what are traditionally covered medical problems, like acne, psoriasis, etc. But during their visit, they request cosmetic services. In your role at the front desk, always keep an eye out for patients who are checking in for visits that seem to be more cosmetic in nature, like mole removal, Botox, etc. When you see these patients on the schedule, ask your management team and/or colleagues whether an ABN should be collected before the patient is brought back. Allowed amount, also known as eligible expense or negotiated rate. The allowed amount is the maximum reimbursement an insurance company agrees to pay for a given procedure or service. When a provider contracts with an insurance carrier, the insurance company negotiates discounted rates for its members. These discounts reduce the cost of services for both the insurer and the patient. For example, if your clinic's standard charge, or list price, for a procedure is $100, but Blue Cross Blue Shield negotiates a 40% discount for its members, the allowed amount for that service would be $60. While allowed amounts are primarily a concern for billing staff, they can sometimes influence how much patients are expected to pay at check-in or check-out. So those working at the front desk need to be aware of their significance. If a patient has a deductible or co-insurance, their financial responsibility is based on the allowed amount, not the full list price. Allowed amounts vary by insurance plan, but most electronic medical records and practice management systems track these negotiated rates, making them easier to manage. Appeal, sometimes referred to as a reconsideration request. An appeal is a formal request asking a health insurance plan to reconsider how it processed a claim. A practice may file an appeal if it believes a claim was incorrectly denied or underpaid. Common reasons for appeals include situations in which a patient's insurance denies a claim altogether, or when they only provide partial reimbursement which doesn't match the fully billed amount. Assignment of benefits. An assignment of benefits is a patient's authorization allowing their insurance company to pay the provider directly, instead of sending payment to the patient. This authorization is often included in the paperwork patients sign at check-in or registration. Without assignment of benefits, the insurance carrier might send the check to the patient, and the clinic would need to bill the patient for the amount owed. Most practices require assignment of benefits as a condition of providing service. Tip: ensure this form is signed and documented in the patient's file. It only needs to be obtained once unless the patient's insurance changes. Balance billing. Balance billing occurs when a provider bills a patient for the difference between the standard or list price of a service and the amount reimbursed by insurance. Earlier, we discussed an example where a procedure had a standard list price of $100, but Blue Cross Blue Shield negotiated a rate of $60. If a practice were to balance bill that patient, it would charge them the remaining $40. In most cases, balance billing is not allowed because the negotiated discount results from a contractual agreement between the provider and the insurance carrier. There are exceptions where balance billing is permitted, but when it is not allowed, attempting to balance bill may not only violate contractual agreements, but in some states and jurisdictions, it can even be illegal. Since this lesson is an introduction to key billing concepts, we won't cover the complexities of balance billing in depth. However, it's important to remember there are